I've watched this exact problem destroy 3 marriages in my practice. And every single time, those couples waited years, suffering in silence, before finally asking for help. Today, we're talking about premature ejaculation. If you've been dealing with this for years, trying everything you can find online and getting nowhere, this video is going to completely change how you think about the problem. By the end, you'll know exactly what works, what doesn't, and what nobody in the healthcare system is being honest with you about. Here's the first thing you need to understand. Premature ejaculation isn't necessarily a disease. For about 70% of the men who walk into my clinic with this issue, it's not a medical condition. It's not an infection. It's not hormones gone wrong. It's just how their nervous system is wired, the way nerve endings are distributed in the penis. And until you accept that, you're going to keep chasing a cure that doesn't exist. Here's the test. Have you always finished quickly? Since your very first time? If yes, this is your baseline, this is you. But if things were fine until age 25, and then suddenly after a breakup, a long dry spell, or after you gained 30 pounds, things changed, then we might be dealing with something else. Maybe a prostate issue, maybe hormones, maybe something we can actually fix. But most of you, you've been this way from the beginning, which means we're not curing anything. We're managing it. We're working with what you've got. Now here's what most doctors won't tell you. The definition of premature ejaculation is completely subjective. Medical literature says it's when you can't last more than 3 minutes. But if you and your partner are both satisfied at 2.5 minutes, then you don't have a problem. You have a statistic. And statistics don't need treatment. I had a patient who came in asking for help because he wanted to last an hour. I looked at him and said, "You last 50 minutes and you think that's premature?" He did, because his new girlfriend told him she wanted longer sessions. That's not a medical issue. That's a relationship issue. So before we go any further, ask yourself, is this actually a problem? Or is this just something you've been told should be a problem? If it's affecting your confidence, your relationship, your sex life in a way that truly matters to you, then yes, let's fix it. But if you're chasing some arbitrary number because you saw it in a forum somewhere, I'm telling you right now, let it go. All right, let's talk solutions. We start with the simplest, least invasive options first. That's how medicine works. You don't jump straight to surgery when there are 10 other things to try first. Option 1. Condoms with desensitizing lubricant, usually lidocaine. They work. They reduce sensation just enough to give you more control. Downside? If the lubricant transfers to your partner, she might lose some sensation too. So either wash it off before penetration or use a second condom on top. Not elegant, but effective. Option 2. Topical anesthetics. Sprays or creams you apply to the head of the penis about 10 to 15 minutes before sex. Same active ingredient, lidocaine, sometimes benzocaine. Same result, you last 2 to 3 times longer. And yes, you can use these long-term. They're safe. As long as you don't have an allergy, there's no harm in using them regularly. Are they a permanent fix? No. But neither is ibuprofen for a headache. Sometimes management is the goal. Option 3. Oral medication. Specifically, SSRIs, selective serotonin reuptake inhibitors. Technically antidepressants, but one of their side effects is delayed ejaculation. And in this case, that side effect is exactly what we want. I've seen men go from 2 minutes to 10 or 15 on these medications. Here's the catch. They don't work for everyone. Some guys get headaches, some get nausea, some feel sluggish or foggy, and the effect only lasts as long as you're taking the pill. Stop taking it, and you're back to baseline. But if you tolerate them well, they can be life-changing. Now let me tell you what doesn't work. Herbal supplements, pomegranate juice, ginseng, vitamin blends marketed as stamina boosters. I've seen patients spend hundreds of dollars on this stuff. It does nothing. And I mean nothing. If your issue is anatomical, if it's the way your nerves are wired, no amount of juice or powder is going to rewire them. Save your money. What does work, and this is free, is the start-stop technique. Here's how it works. You bring yourself close to orgasm, then stop all stimulation. Wait 20, 30, maybe 50 seconds, however long it takes for the sensation to back off. Then start again. Repeat. You're training your brain to recognize the point of no return and pull back before you cross it. This isn't a one-time thing. You have to practice it, alone or with an understanding partner. But over time, weeks, sometimes months, it works. You learn control. You desensitize the reflex. You turn 2 minutes into 5, then 5 into 8. I've had patients double their stamina with this technique alone. No drugs, no surgery, just deliberate, consistent practice. And here's something I didn't understand until a few years into practice. A lot of men naturally get better at this as they age. Hormone levels shift. Anxiety decreases. You've seen it all before, so arousal is less hair trigger. I've had guys come back at 35 and tell me the problem that plagued them at 18 just went away. But let's say the conservative options aren't enough. Let's say you want something more permanent. That's when we start talking about procedures. The first surgical option is frenuloplasty, removing the frenulum. That's the small band of tissue on the underside of the penis, right below the head. It's one of the most sensitive areas. Remove it, and you remove a major source of stimulation. It's a simple procedure. Local anesthesia. 15 minutes. And for some men, it's exactly the fix they need. Does it work for everyone? No. But it's low risk, and if it helps, the effect is permanent. The frenulum doesn't grow back. Next step up. Circumcision. But not the kind most people think of. If you're doing this to address premature ejaculation, the technique has to be specific. You remove not just the foreskin, but the mucosal tissue that transitions from the shaft to the head. You remove the frenulum completely. You leave the glands fully exposed. Why? Because constant exposure toughens the skin, desensitizes it. After a few months, the head of the penis is less reactive. You last longer. Here's the part nobody warns you about. It can get worse before it gets better. Right after the procedure, the head is hypersensitive. Everything feels too intense. That phase can last weeks, but once the skin adapts, most guys see real improvement. 2 minutes becomes 10. 3 becomes 15. Does it work for everyone? No. I've had patients who did everything right and saw no change, but I've also had patients who went from barely lasting at all to having completely normal sex lives. And yes, it's permanent. You can't undo it, so you'd better be sure. Now we get into the more experimental options. Dermal fillers, the same kind used for lip injections, can be injected into the head of the penis and around the urethra. The filler creates a buffer layer between the nerve endings and the outside world. You still feel sensation, but it's muted. The effect lasts 6 months to a year, depending on the product. Then it's absorbed, and you're back to baseline. Want it again? Get another round of injections. It's safe. It's reversible. And if it works for you, it's one of the least committal options on the table. Here's the test. If topical anesthetics help you, fillers probably will too. If numbing cream does nothing, fillers probably won't either. Then there's denervation surgery. This is the most aggressive option, and I only recommend it after everything else has failed. Here's what happens. We make an incision at the base of the penis. We identify the dorsal nerves, the ones that carry sensation from the head back to the brain, and we selectively cut some of them. Not all of them. That would leave you numb. We cut the larger ones, anything over 2 millimeters, and the very small ones, under 1 millimeter. We leave the mid-range nerves intact, spaced evenly around the shaft, so sensation is preserved but dulled. When it works well. Men go from 1 or 2 minutes to 10 or more. It's life-altering. But here's the risk. Once you cut a nerve, it's gone. If we take too much, you could lose sensation entirely. I've seen it happen. Rarely, but it happens. And here's the other thing nobody tells you. The effect isn't always permanent. Nerves are tricky. The ones that remain can sometimes take over the job of the ones we removed. After 6 to 9 months, some men start to see a return of sensitivity. Not all the way back, but enough that the problem creeps back in. Can you repeat the surgery? Technically, yes. But there's less to work with the second time, and every surgery carries risk. I had a patient who had this done at 42. Fantastic results for 8 months. Then it started to fade. He came back asking if we could do it again. I told him the truth. We could, but I wasn't sure it was worth it. He decided not to. And you know what? He was fine. He'd learned enough control in those 8 months that even when the full effect wore off, he was still in a better place than before. There are 2 newer techniques starting to show up in the research: radiofrequency ablation and cryoablation. Instead of cutting the nerves, we use heat or extreme cold to damage them. The advantage? It's repeatable. If the effect wears off, we can do it again. And if something goes wrong, the damage is often reversible. The nerves can heal. The downside? These techniques are still experimental. Very few centers offer them. The data is limited. And insurance, sure as hell, isn't going to cover it. I'll be honest, I don't recommend them yet. Not because they don't work, they might, but because we don't know enough about long-term outcomes. Some of you are probably wondering, is Botox an option? Yes, sort of. There's research showing that Botox injected into the bulbospongiosus muscle, that's a muscle at the base of the penis, near the urethra, can delay ejaculation in some men. The theory is that it relaxes the muscle involved in the ejaculatory reflex. Does it work? For some guys, yes. Temporarily. Botox wears off after 3 to 6 months, so you'd need repeat injections. Is it mainstream? Not yet. Most urologists aren't offering it, but it's on the radar. Now let me tell you what I've learned after years of treating this condition. The solution that works best is almost never the most aggressive one. Most of my patients who are happy long-term are the ones who found a combination of low-intervention strategies that fit their lives. A condom here, a spray there, the start-stop technique when they have time, an SSRI when they're going through a stressful period and need a boost. They're not chasing perfection. They're chasing good enough. And you know what? That's smart. Because here's the uncomfortable truth. If you've lived 40 years with a 5-minute session and been reasonably happy, maybe the problem isn't the 5 minutes. Maybe it's the story you've told yourself about what 5 minutes means. I had a patient, 74 years old, come in asking about denervation surgery. I looked at him and said, "You've made it to 74 with an active sex life. You're still functional. Why are we trying to turn 5 minutes into 8 at this stage?" He didn't have a good answer. Sometimes the healthiest thing you can do is accept what works and stop chasing what doesn't matter. But if this is really affecting your quality of life, if it's damaging your relationship, your confidence, your happiness, then don't ignore it. Don't suffer in silence, and don't let shame keep you from asking for help. Start simple. Try the techniques that are safe, reversible, and cheap. If those don't work, escalate. Talk to a urologist who specializes in sexual medicine. Not just any urologist, but one who actually knows this field. And talk to your partner. I can't tell you how many men I've treated who never once had an honest conversation with the person they were sleeping with. You'd be surprised how often the solution isn't medical at all. It's just communication. Next time you're at your doctor's office, ask the question. Don't dance around it. Don't wait for them to bring it up. Most primary care doctors won't unless you do. Take care of your health. Take care of your relationships, and don't let this problem sit in the dark for another decade. I'll see you in the next one.